Minister, I have one very clear and concise request for the Department tonight, that every maternity unit in our country should publish their risk assessments each month, or whenever a new assessment is completed, so that people accessing those services can understand why they are now not allowed and still not allowed to receive supports from their partners in some hospitals. During the pandemic, partners were banned from appointments in order to curtail the spread of COVID-19 in clinical settings, and I think we all understood that. And the reality is, even now, those restrictions are still in place, and in some units, visitors are restricted to one designated support partner. In some cases, some partners aren't even allowed into particular appointments. Time and again, I've stood in this House and outlined the negative consequences for partners, for women, for families, but more importantly for infants, when people are not supported during childbirth. And the ongoing exclusion of partners from antenatal appointments, from assessment units, is being implemented by individual hospitals, and I think we all know that, but ultimately it's the Department and the Minister who has a responsibility here to address the ongoing constraints. They're contrary to the best care and the best practice for people who are giving birth. During the pandemic, at least, the restrictions were part of national guidance and were developed in collaboration with stakeholders, with patients and with senior HSE executives. But the current model of decision-making seems very regional in its approach and highly specific. And really what I'm asking for tonight is not necessarily to override those decisions, but simply to make those decisions legible to the people that they're affecting. From Wednesday last week, obviously, mask wearing is no longer mandatory in hospitals, except in certain circumstances, and really that is the last vestige of COVID leaving our system, and I think we're all happy to see that. But it makes the continuing existence of some of those restrictions in maternity units even more baffling and really hard to understand for the families affected. So, I think, to put it mildly, maybe it's a significant understatement, we don't always have a very positive legacy in this country of listening to women in terms of their health care and in terms of what they need. And it's really frustrating that I'm still, people still have to come into this chamber and talk about maternity restrictions and kind of ask the government to provide guidance to maternity units. But it's now more than 3 years since partner restrictions were implemented in maternity units across the country. Thousands of people have laboured alone. Thousands of people have given birth on their own without their partner, the person who knows them best, but also the person often who is the other parent of the child in question. There are people who have suffered unbearable losses in our maternity units on their own without their support there, and people who have had to cope with sick infants and dealing with the impacts of that on their own. There are partners who are sitting in car parks or at home wondering how their very much loved family is coping without them, and knowing for certain that that family might not be coping and are still on their own. Minister Donnelly in August 2021 confirmed that nationwide restrictions are no longer in place and that partners could once again be present to support during maternity care, and I think we were all hoping that that would be in its entirety, that you could come to everything. So I truly don't understand why we're still here, still talking about. I'm still getting emails, I'm still getting phone calls from people who are distressed, and we know that it's affecting people who maybe don't have English as a first language, who might be from, a particular vulnerable cohort. They might not have the agency to challenge decisions. So it's really important that when those decisions are being made on a specific basis, that we're making it legible to people and saying, here is the risk assessment, this is why the decision is made, it's available to you and it's public.
Thank you. Minister.
Thank you, Deputy, for raising this really important issue, and I know it has been an issue of concern for women and their families. And I fully appreciate that limitations on partners accessing maternity services have been very difficult for everyone over the course of the COVID-19 pandemic. That's why I was surprised when I read the question that I was going to be reading the response to today. I wasn't aware that partner restrictions were still in place. I don't believe they're in every maternity hospital, but obviously they're still in some. And you being a mother like myself, and we have plenty of dads here in the room, in the Dáil here, it's the one time in your life well, there's a lot of times in your life when you need support, but it's a really important time in your life that you do need to have support. The objective throughout COVID had always been to keep maternity services as safe as possible, to support the woman on her pregnancy journey, and to facilitate access for the nominated support partner. Maternity services have remained focused on maximising access, and in effect all restrictions that were introduced during the pandemic have now been removed, including for routine scanning, labour delivery and time spent on antenatal and postnatal wards. However, the clinical advice has always been focused on the potential for infection to spread in maternity services, and the highest priority is protecting the health and safety of the woman and the babies in our care. Variations exist across our maternity services and hospitals, which include caseload, complexity and infrastructure. This all feeds into decisions made in relation to infection prevention and control risks in our maternity services. Deputy, the HSE has advised the Department that the HSPC guidance and restrictions that were in place regarding access to maternity services in the context of COVID-19 are no longer applicable. That's why I was surprised that I was answering this question. There are limited exceptions introduced at times based on local infection control and health and safety measures, and I think everyone appreciates that there are times when local infection does take over. However, limitations on access for nominated support partners should always be the minimum required to manage the risk. They must be clearly explained and they should be applied with consideration for individual circumstances and needs. In all circumstances, a person-centred approach should be adopted to recognise the context in which the presence of a support person is required. Each maternity service assesses their ability to accommodate access for partners in the context of local facilities' infection control requirements. For example, in light of the recent fire at Wexford Hospital, while support partners can attend all antenatal appointments, they are requested to wait outside while their pregnant partner is called for her appointment, until the pregnant partner is called for their appointment. The HSE recognises that a nominated support partner plays a central part in supporting a person using maternity services. The support person also has a right to be present and to participate in the care process to the greatest practice degree. Regarding children visiting at maternity services, as in all other hospital settings, in circumstances where a woman has a long length of stay, the hospital should provide reasonable access for her children to visit her. To conclude, I would like to assure the Deputy that any access limitations that individual hospitals may implement from time to time are necessary in terms of infection prevention and control. A decision to limit access is taken locally by clinicians and hospital management who know their own circumstances intimately. The HSE has assured the Department that every effort continues to be made to maximise access for partners and their loved ones during their maternity care, but it's obvious at the moment that this is not the case in all hospitals, as you have outlined.
Deputy. Minister, and I know you fully understand the issue, and I'm sure you're also getting constituents or people around the country raising it every so often. And absolutely, it's not all hospitals. There's only some units where this seems to be raising its head, and to be honest with you, I think that's maybe part of the problem, is that it isn't a kind of a nationwide standard, and I absolutely accept that every unit is different, and I know that we are very aware that our infrastructure in our health service is not always what we want it to be, and we're dealing with older buildings, and capital spending on that and the upgrade of maternity hospitals has been a particular focus of this government, and I think that we are doing good work there. But I suppose I wanted to focus tonight not on querying whether there would ever be restrictions, but on querying the fact that we don't make that very readily available, the thinking behind it and the reasoning behind it. So in preparation for today, I did actually have a look at what's happening in other countries, and I reviewed 10 NHS trusts with maternity units in them. Of those trusts, 8 of those trusts provided the risk assessments from at least the last 18 months, and the remaining 2, one was 2 years old and the other was 3.5 years old. So there's to my mind, no reason. I know those risk assessments are being done. I know in a clinical setting, you know, the people who are operating maternity units are well used to evidence-based decision-making, and they are making those risk assessments based on, you know, what they have to hand. It's not, I'm hoping and I'm assuming that it's not something that they're doing without due consideration. And the request is to make that consideration publicly available. All of our hospitals and all of our hospital groups have, from what I can see, fairly well operating websites, and they do have a platform whereby they can communicate with the public, and it would be incredibly helpful for people, and particularly those more vulnerable cohorts where, you know, they might be in a group where they don't feel that they can speak up, and they don't feel like, you know, that they understand what the minimum requirement is to manage risk. That you know, that thinking and that outline and that risk could be made available to them.
Thank you, Deputy Minister.
Cathaoirleach, and Deputy, again I want to acknowledge how extremely important the support of partners is for women throughout their pregnancy journey, and indeed how important it is also for the partners that they are present as much as possible. And you know, I think you might have hit the nail on the head when you talk about some of the older buildings, some of the risk assessments, and it is really important that we have evidence-based decision-making in relation to these restrictions, because it's very, very difficult on families at a joyful time that there might be those restrictions that might, you know, that this happens. And I just want to make one point, if I could. We have 19 maternity hospitals in Ireland, and I would just like to say perinatal mental health supports are available in every single one of those 19 hospitals. And if there is, you know, any person, whether before, during or after birth, that they do present and they have mental health illness or mental health challenges, or in some cases for a pregnant woman it might be just purely the anxiety of maybe being a first-time mother and the difficulties. This has been one of the success stories in relation to our mental health, the fact that we have this rollout across every single every single maternity unit in Ireland. And last year I was delighted to visit the Rotunda, and of the 1,000 mothers that presented last year, 20% of them used the perinatal mental health supports. So I know I diversed a little bit, but sometimes, you know, it's important to get that message out there, especially for mothers that might be feeling vulnerable and they mightn't have access to the language supports that they need, that there are supports being provided in the hospital. I do think you made a really valid point about the risk assessments and about having that information available to you, and I will certainly take it back to the HSE on your behalf. And thanks again for raising this. I didn't think I would be answering this particular question at this stage in COVID, but I do understand that infection prevention and control measures are really important, and I suppose they're always taken to support the mothers and the babies, especially in the neonatal units. Thank you.